and the misconception on how to utilize it. Even though patient care is rapidly changing, the quality is increasing. This care is being used more in the recent years. It is still being used too late because people are undereducated. Sims, the writer of a journal entry for Medscape, states hospice is not a place but a concept for healthcare delivery to those dealing with life limiting illnesses. He also goes on to talk about how hospice is designed to provide comfort and support for hospice appropriate patients and their families in order to improve quality of life. Many people don't take advantage of hospice because they have the misconception that it means giving up. Families believe that they are giving up on mom and dad or grandma and grandpa, but that's because they don't understand the purpose of hospice care. Hospice is a system of care designed to relieve suffering and promote quality of life for people living with terminal illnesses, Tulsky says in his book, Understanding the Hospice Care. Pain management is the biggest area for hospice care. Treating hospice patients may involve medication dosages that have adverse effects that may not be acceptable for a quote unquote healthy person, but would be prescribed for a dying person because it's acceptable for managing pain is the priority. Along with pain management, hospice is also focused on physical, emotional, and spiritual needs for the hospice patient and their families, whether it be last wishes or religious practices. Many who are given the option to have hospice care have the misconception that it means giving up. However, hospice is for when treatment is no longer working. Tuskegee says in his book, the best time to consider hospice is when one is living with an advanced life limiting illness and cure directed therapies are no longer working, or when the burden of such treatment outweighs the benefit. Like most things, death has stages, and because hospice is often used too late, is why many people believe hospice is for the actively dying. I work in a long term care facility and regularly come in contact with perfect candidates for hospice care. Patients who are in extraordinary pain and simply worn out, but the patients themselves or family believe that that means giving up. So many patients suffer and go through invasive surgeries and chemo, but their stage and the disease process is incurable. Hospice care is focused on quality of life. I'm going to share with you what hospice entails and the medication behind the scenes to making the best care to diagnosis and the type of care that's given. Hospice care is used to help maximize the quality of life for people with fatal illnesses. Those who have accepted their illnesses and are now focused on comfort care rather than prolonging life. Now we will talk about who is an acceptable candidate for hospice. Hospice is appropriate treatment when a treatment is no longer the goal of care, but comfort is. Patients has signs of chronic illnesses and interferes with normal routines and quality of life as they're diagnosed with progressive illness with complications. A patient must have made the decision to not pursue curative treatment or has had the treatment and it's failed. A patient must understand the disease process and understand that hospice is not focused on prolonging life, but making the last phases of life more comfortable and manageable and for a better quality of life. When is it time to start talking hospice? Now I'm going to play a video.
Crossroads defines the point of curative medicine and palliative medicine that you are going to change the focus of how you're looking at your life from these days forward.
A family should think about hospice when they realize that conventional curative treatment is no longer effective, or that they realize that the treatment, basically the distress and the discomfort from those treatments are no longer worth it. So the sooner that they are admitted to Crossroads, once they reach that stage, the better off the patient and family are going to be.
The difference with Crossroads timeline, though, is that the things that we plan and the programs that we have for our patients involve us being extremely aware of where the patient is in their disease process and where the family is in the journey. So we do everything we can to journey with the patient and the family to provide the programs that we have in place.
We're going to be able to intervene sooner and make sure the patients, we're being proactive so the patients aren't experiencing those symptoms that they usually have at those latter stages. We're going to prevent those from occurring instead of trying to treat them after the fact.
The timeline of a patient's journey with us is very important because it allows us to be aware and to be attentive to exactly what's going on with that patient and that family, so that as the disease process progresses, we can actually be there for them in mind and in spirit and emotionally, physically. We can be so in tune with what's going on with them.
So for someone to be admitted to Crossroads, I want them to know that they should be comforted knowing that they're going to get the best hospice care available.
A study shows that more than a quarter of hospice use in the 2009, there were 3 days or less, and that the referrals followed a hospitalization or an ICU visit. That means that the people that have already been diagnosed with a life-threatening illness spent their last days going through treatment and invasive surgery that they just didn't need to do. Okay. Did you?